Due to recent frigid temperatures exacerbated by wind chill, I felt it would be appropriate to discuss some of the dangers associated with winter and how to prevent cold-related injury. With me today on Missouri Medical Focus is Dr. Jeffery Witt, Medical Director of University Hospital's Burn and Wound Program, and Kassie Oliver, Injury Prevention and Trauma Outreach Education Coordinator for University Hospital's Trauma Program. Kassie, what are some of the most common injuries associated with extremely cold temperatures?
So a couple things that I would say would be frostbite, hypothermia, and maybe even some frostnip.
What are the symptoms of hypothermia?
So hypothermia, you're going to have some slurred speech, some fatigue, some difficulty breathing, clumsiness in your extremities, shivering, forgetfulness. Those are some typical, most significant symptoms that you would have at first.
Is there any time frame or any length of time that a person needs to be exposed to cold temperatures before that kicks in?
It could be short exposures to extreme temperatures or long exposures to cold temperatures. And there's people that are more susceptible to those types of injuries, people that are diabetic, children, infants, people that have neuropathy or immune disorders could be more at risk for those injuries.
What steps should a person take to provide first aid if they notice someone has hypothermia?
Sure. The first thing that you should do is get out of those temperature extremes and slowly rewarm and probably contact a Health Connect 24, go to urgent care, or possibly the ER if you're having severe symptoms.
Dr. Litt, my understanding is frostbite is actually fairly similar to a burn. What are some of the symptoms of frostbite?
Well, frostbite is considered a thermal injury, like a burn is a thermal injury. When we talk about thermal injuries, we include the cold temperature injuries equally with the hot injuries or the burning injuries. Folks who get frostbite is actually graded similarly to a burn injury as well in terms of degrees, first degree, second degree, third degree. One often sees initially just cool bluish skin with early frostbite, and then one can start developing blisters. Initially you would see the blisters with clear fluid, and then as the frostbite is more severe, the blisters can fill up with bloody exudate, which indicates a more severe injury. And finally it can progress all the way to tissue death and gangrene, which would be the most severe form of frostbite.
And as I asked Kassie, is there any time frame, or again, is that pretty much dependent on the individual with respect to exposure?
It's dependent on the individual. It's dependent on their age, the ambient weather conditions, like the moisture. Certainly someone who has moist clothing around them and then is exposed to the cold is much more susceptible to a more severe injury in a quicker period of time than someone who is just in the dry cold.
What is the treatment for frostbite, and when is an emergency room visit necessary?
So, like hypothermia, systemic hypothermia, which Kassie was talking about, the treatment for frostbite is rewarming, but it's gentle rewarming. It's not very aggressive under hot water or in a hot bathtub, because that can actually cause increased tissue damage. With systemic hypothermia, if you warm too quickly, not only can you get tissue damage, but you can get other electrolyte abnormalities and cardiac dysrhythmias and things like that. With frostbite, because it's a local injury, if you end up heating up the tissues too quickly and they release all of the byproducts of their damage, all of a sudden that can increase the tissue damage. So it's gentle rewarming over a controlled period of time. And this is probably best done in an emergency room at least, and probably in a burn center where we're used to dealing with injuries similar to that.
You're listening to Missouri Medical Focus on KBIA 91.3 FM, and our discussion is about cold-related injuries. Dr. Litt, as the temperatures drop, we all do what we can to stay warm. I would anticipate that you see an increase in the number of burn patients during the winter. Would that be correct?
We see an increase in the number of severely burned patients in the winter because in the winter the fire injuries that we tend to see are involved with house fires. The national burn data suggests that house fires are not the most common cause of a burn injury, but they're typically the most serious and the most fatal.
What are some of the most common causes of house fires?
Probably the most common cause of house fires is either the use of space heaters inappropriately or the use of open candles, open flames during the cold winter months. In and of themselves, those two in combination comprise about 60 to 70% of the causes of house fires as far as we can determine with the accident scene investigations.
Kassie, what are some of the other reasons, or what are some of the other causes of house fires or these burns that you see in the burn center?
People putting things over their space heaters and not leaving them
So
just
like
as
wet
they
clothes,
are.
trying to dry them on space heaters?
Correct. Or, you think you just put your towel down and you don't even realize that you put that on a space heater. Those need to be shut off before you leave the home. Shut off your heater. Don't have those around children. Make sure that they're being monitored. There's this 3 feet rule that you should have as a kid zone. That includes a fireplace, a wood stove, any sort of heating element. Make a zone where your kids aren't allowed. Just sitting by the chimney or the fireplace is a good way for kids to get a burn, whether that's like just a partial thickness burn because they're sitting right near it and the heat itself is causing the burn, or kids go up and touch their hands against a fireplace, the glass fireplaces or anything. That's extremely dangerous for kids this time of year.
Is there anything that I've missed that you think is important?
Sure. One of the major things that can happen is it's cold. People want their cars to be warm when they go outside. A lot of people have automatic starts or they go start their car. If you do that, great. But make sure if your car's in the garage or an enclosed area that you are well ventilating that area, your garage door's up. Otherwise, that can lead to some carbon monoxide poisoning.
Dr. Litt, the same question for you. Is there anything that you think is important that I missed?
As people are trying to stay warm, they use different methods. We talked about space heaters. Aside from the fire hazard of a space heater, there's also the contact burns that one can get from being too close to a space heater, particularly in folks who are predisposed to having problems with their nervous system, such as neuropathies due to diabetes or other conditions. I've seen lots of primarily diabetics, but folks who suffer from neuropathies who, in efforts to keep warm, keep a limb or a heating pad on a portion of their body, don't feel how hot it gets, and it stays there for a long period of time, and then all of a sudden they've got a third-degree full-thickness burn that needs surgery or gets infected. So that's something that I'd like to reiterate as well, that if you're going to be using space heaters or heating pads, make sure that you have them at a safe temperature and make sure that you don't keep them on for too long a time. And if you're going to go to sleep, turn them off.
I'd like to thank both Dr. Litt and Kassie for being my guests. From Missouri Medical Focus, I'm Jeff Helsher.